much for all your help and all the changes, long-term, lifelong changes that you've made to our lives, and for our beautiful, beautiful, beautiful son who is, peacefully sleeping away, oblivious to the challenges that he causes mummy and daddy.
Hello everyone and welcome. It's Gabriella Rosa here, and today I have the beautiful, beautiful Essie. Thank you so much, my darling, for agreeing to come and tell your story. I know it's such an amazing, amazing story, and it's so inspirational on so many levels. And so I would love for you to share with us a little bit more about how it all happened for you.
Okay. Well, I'm a medical doctor. I'm a consultant in the NHS in England, and we'd been only trying to conceive for about 4 months before I went to the GP. So the guidance in England is that you should try for a year, but if you've got underlying medical conditions that might make it harder, then you should get tested earlier. So I went to see a GP who flat out refused to test us. Went away quite upset because we've both got quite serious medical conditions, and I knew that it would make it harder to get pregnant and harder to stay pregnant for me as well. I went back to see the lead GP, who completely agreed that we should be tested. For some reason, I think there was about a 3-month gap, so I think I was a bit defeated from the first GP appointment, but I was like, no, like something's not right. So we went back. She organised a whole load of tests, and then my partner's test showed severe male factor. So he had one test, and then he got recalled for a second, which we were told to expect that, but we didn't see a doctor in between. So when we went to see the GP, she was like, oh, so this just confirms the bad news. It was really broken, really bluntly, no idea.
Oh my goodness. It's crazy, isn't it? Because I mean, even as a doctor yourself, you kind of go, hang on a second, that surely there's a little bit more.
So, you know about this? Where are we up to? There was, sat down in the chair. So, you're going to have to see this fertility specialist at the central hospital. And I was like, right, okay.
What a shock.
At the surgery, but when we got home, I was crying for hours. So I never imagined having a husband ever. I do have a husband now, but I've always imagined having 2 children. That's like,
wow, isn't it amazing? It's like, it's so set, isn't it? Like the things that we kind of desire and the things that we want. It's like, I know that this is going to happen.
It's the only thing in my life that I've ever been adamant that I want, and I would do anything to achieve. And people in my life who know me were like, you really did do anything to achieve that. They thought I was crazy. Most people thought I was crazy.
Luckily we know better, right? And the benefit of hindsight as well is always a wonderful thing.
Massively. Nothing's impossible, really. So we went off, we saw the fertility consultant about 9 months after we'd been trying, so quite early. He was a little reluctant to treat us, me particularly. I think he, in his letter, described us as an interesting, complex couple. And
we all know what that translates to.
Yeah.
Oh my God, no.
Said that the IVF might make me unwell, which was understandable. So I spoke to my own consultant, who very rightly said that I should have as much chance to have a family as anybody else. He was really good, actually. He was like, I've treated people that have had twins, triplets with your condition, and whatever happens, we can manage it. So I was like, right, wanting to go ahead. So we did our first ICSI cycle about a year after trying, and the cycle was okay. We weren't getting huge numbers of follicles or anything, but I was hopeful. Before the actual IVF ICSI cycle, our clinic did this sort of holistic care series of evening presentations. So they talked about a healthy diet, reducing plastics, some of the supplements that can be like broadly suggested useful for a female population and male population. So we'd sort of been doing that sort of stuff, but not in anywhere near the detail that the program does prior to the conception and prior to the program. So I was like, we're pretty healthy anyway. I love exercise. It's like my mental health thing. So, I thought we had a good, healthy lifestyle. And then we got, I can't even remember how many eggs, but basically nothing fertilized. We got the phone call. I was expecting there to be like a low number, but still, I didn't know zero fertilization was a thing. Again, more crying, and I'm very much research based. So I then, spent hours and hours on the internet looking at other cases of zero fertilization and why it happens. And there's some interesting centres of study in Belgium and in Oxford that look and specialise into cases of no fertilisation. So we sort of met with them. Well, firstly, the test in Oxford to specifically look for a protein that causes no fertilisation couldn't be done because there wasn't even enough sperm to do that. And that was in Oxford. And then we went to Belgium, and again, there wasn't enough sperm to do a different test that they do in Oxford. So it was like really severe male factor. So we went off, and our NHS fertility consultant basically said, well, let's just do it again. And I was like, are you going to change anything? Is there anything else we can do? It's like, no, we'll just do exactly the same thing again.
The usual story, isn't it? It's a little bit crazy to think that, gosh, here we are. And 2 cycles, I mean, we now know there was a retrospective analysis, I think 2016, published in Human Reproduction, the journal, and it showed that on average, a couple needs, and this was out of 178,000 patients, and on average, you needed 8 IVF cycles in order to have a close to 80% live birth rate. And I mean, if you think about that, right, and the fact is, if you have an average of 8, you've got people who have had 30. And, you've got obviously people that have had less. But it's amazing how typically, as I think that we've discussed before, it's so protocol-based without really, kind of understanding the underlying factors that are getting in the way.
No deviation from, you might do better with this because it's yours. So it's like, right, tick box, tick box, tick box. And actually our clinic, a lot of it is nurse-led, protocol driven. So you see the consultant at the beginning for the appointment, and then you don't see them again. So if there's anything that deviates from the pathway, then they're just like, oh, well, this is a pathway. So it is quite frustrating. And because of my medical condition, he didn't want to try any higher stimulation or anything. He was just like, this is as far as I'm willing to go. So I was like, okay. So we then went to do the second cycle. So coming up to that, I think I somehow found your challenge, I think, on Facebook. And I signed up to the challenge. I was all like, oh yeah, I'm going to do the challenge. And then, the first 2 days, I was just like, oh my God, this is like, I'll just watch. Like, I'll watch and I'll take in some of the principles, but I definitely wasn't chucking out all my cleaning stuff. I didn't do the lemon drink. I was just, I just changed things I felt I could change easily. So using glasses instead of plastic, water bottles, food containers, not using the microwave, that sort of simple stuff that wasn't too strong.
The reasonable things, none of this crazy stuff.
A pressure of like the IVF cycle, and in my head I was like, I hadn't really bought into it yet, basically.
What's fair enough. And that's the thing, isn't it? It's interesting how sometimes it really does take a whole lot more research and understanding and going through more pain, right, to be able to kind of go, hang on a second, there has to be a different way.
For me, it took rock bottom. It literally took, I know you say...
Yeah, look, I can understand that too, Essie, because with your training, as a doctor, as a medical doctor, your training is very different to essentially, many of the things that we talk about. And so it's kind of like, hang on a second, that makes that's crazy. That makes no sense.
Actually, I was thinking about this earlier tonight. I've got a friend who moved to Australia, and she's become a naturopath. And I think if I'd known about it, before I picked medicine, I would maybe have gone in that direction, because it very much fits with my values.
Philosophy,
but, when you're picking your choices at school, like, no one goes, oh, this is a possibility. You just, my parents are doctors, and, I'm good at science and maths. I was like, I'll do that.
I'll just follow on the same school line.
I literally tell you, the only thing chosen in my life is my children. The rest of it, I've sort of just, that's the only thing I've wanted, is really wanted.
Fascinating.
I do actually love my job, but it, I sort of just fell into it.
Yeah. No, that's the thing. Sometimes life circumstances, right? So it's kind of like where you stand and the things that you've got, role models for and everything else. And you just kind of go, okay, well, I'll do that. But in terms of, how that affects your choices then in terms of treatment, obviously there's big discrepancies, there's big disparities in philosophies and, paradigms. And so, of course, the fertility challenge to begin with probably would have been like, whoa.
A consultant at the clinic who does believe in holistic approaches. And I think if I had been given that consultant as my consultant, again, things might have been completely different. Because my consultant, very senior consultant, just didn't believe in it. He just had, didn't have time of day for it. So then we did our second IVF cycle, slightly better, got one embryo, and then I got a bad infection, which, is a risk for egg collection, but it's particularly high risk for me. So despite giving antibiotics at the time of the collection, I had a really high fever for about 5 days. I was in bed for about 5 days, but I was still called midpoint to come and have the embryo put back, despite still having a really high temperature of 39. Sort of argued my case. They were like, well, this is the best chance for the embryo. Went home, tried to find any papers with positive implantation rates with pelvic infection, and there was zero. They basically all said there was zero implantation. So I cried and I cried. I was literally just kept repeating that I was boiling my embryo. I was just so distraught and upset about it. That wasn't even our rock bottom. Our rock bottom was being refused adoption later, which comes about 4 or so months later. So when we went back for our follow-up appointment, our consultant basically said that I must have poor eggs for us to have 2 bad ICSI cycles.
But let's not talk about the sperm and all of the male factor. Let's just blame the egg, because it's the easy thing to do.
The eggs are terrible. You should get a donor embryo. I'm in a mixed race relationship, so it makes it quite difficult to get a mixed race embryo or a black donor with a white donor. We did look. It is genuinely quite difficult to find that sort of arrangement. And pregnancy was always going to be quite difficult for me. So I was like, right, well, if it's not going to be genetically mine, then I'm not particularly fussed about being pregnant. So we went off to an adoption open day, all full of hope, yay, could have a child soon. I wasn't even bothered about having a baby, just we could have a child soon. Only to be told that my husband was waiting for a renal transplant, only to be told that we couldn't adopt until after that had happened, which most of the time relies on somebody randomly dying. So you don't get
kidneys just, coming out of somewhere.
We could have been waiting years and years. So we decided to go back down the donor route, but also look at doing a tandem cycle. At which point there was another one of your challenges going, and I was like, right, something really needs to change. So we, full on got into it. I actually quite like the lemon drink. My partner does not.
It's an acquired taste, let's put it that way.
I quite liked a lot of the food on the challenge and still eat, plenty of the dishes from the meal plan. I think it's all really nice. So my partner very much just followed along. If I said it was important to me, then he was willing to do it. And then I can't remember, is it 12 days?
It is, yeah. It is now, yeah.
Towards the end of the challenge, it starts talking about, well, if you want to take things further and go into the program. I was like, yes, I do. I just wanted to crack on. It was quick, but it didn't feel pressured at all. And I don't know, I just very much clicked with you and the program and the holistic person at our fertility centre. I just didn't vibe with her. So, if I'd have maybe sought her help from the beginning, things might have been different. Who knows? But you do have to have some sort of connection with the people that you choose to have
for sure
treat you, basically. So, signed up. It was all very quick. It was just before Christmas. I had our first Alison before Christmas. She was like, right, let's get everything.
Let's get it on it.
Get on the Christmas post so you could get it before Christmas. And then we started our journey. And I would say the first 2 months were really quite intense. There was a lot to do. It just goes so much deeper than the fertility challenge.
Oh gosh, yeah. I mean, I like to describe the fertility challenge is not only the tip of the iceberg, but it's an educational event, right? It opens people's eyes to what else is there, what else is possible. But ultimately, it's not treatment, right? And certainly it's not customized treatment. And what's interesting, about what you said, one of the interesting things that we see, because we do treat patients in literally over 110 countries, we've had now in the fertility challenge itself, close to 140,000 people in more than 100 countries. And we treat patients in every continent other than Antarctica, which means that we are privy to protocols and treatments from people all over the world, the things that they've tried, the things that haven't worked. So we know, that not only we are at the leading edge of what it is that we do, we also know that there is absolutely nobody else out there doing what we do in the way that we do it. And so, the fact is that sometimes things might look similar and might look like, oh yeah, that's the same. It's not, but you're right. The reality is that it's an incredible difference between the two, the fertility challenge versus the Fertility Breakthrough Program, for sure.
And the testing, was to another level, and it basically found me and my partner's major factors. But his major factor was a high homocysteine level, which is just so common in renal failure, but they don't even test for it in the NHS.
Exactly. It doesn't even get looked at.
They don't treat it. And the more I looked up, I was like, but it causes strokes and heart attacks and all these vascular problems, and vascular problems are very common in renal failure, but you've got a possible really cheap treatment and it's just completely ignored. It's probably...
And it's that combination, isn't it, of multiple different things. It's the minor factors that we talk about and obstacles to optimum health and optimum fertility. It's so important to address the person holistically. It's the key differentiator when you're talking about optimizing fertility. Often we talk about in reproductive medicine, it's literally about the egg and the sperm. Right? In terms of how we look at treatment, it's really looking at the whole person and figuring out, okay, what are the biochemical steps that we need to take in order to get a different outcome, a different result? Because most people come to us with the result or the outcome of infertility, recurrent miscarriage, the things that essentially have happened that have led to this result. But it's a biochemical chain reaction, really, that has led to this result. It's not just, one day you wake up and you can't have a baby. It's like there are reasons for it. And the biggest cop-out, and actually I think that you will definitely agree with me on this, I think the biggest cop-out in reproductive medicine is the diagnosis of unexplained infertility, right? Because it's like, well, what does that mean? Have we actually looked at some of the possible explanations and what else is going on?
It's just so basic in the NHS.
We just go, oh yeah, no, it's unexplained. Well, but hang on. What does that actually mean? Yeah.
So we had the testing, we had the supplements, we had the diet, we had the environmental biologist, which I strongly believe. So I'm a radiologist, so I know about radiation waves, and my partner thinks I'm nearly at the stage of wearing a tinfoil hat around my head, but I'm like, the further you can get away from a radiation source, the radiation drops off. So if we just switch off all of the Wi-Fi's, all of the Bluetooth, it makes a difference.
Absolutely. I'm so glad that somebody understands what I talk about all day long.
Yeah, so like I said, he's happy to go along for the ride. I'm still not sure, even despite us having our baby, still not sure he quite believes in it all, but he's, so about, I don't know, maybe about 3 months into the program, he was getting increasingly ill and getting towards dialysis. So he couldn't stick with much of the diet because of the dietary changes that were advised to cope with the dialysis. And I was getting quite sick from the supplements, really quite sick. I got admitted to hospital with my condition, first time in my life. I was just having problem after problem after problem. So we basically stopped all my supplements. Again, me back on Google, reading lots of research papers. And together with Alison, we basically decided which ones to stop that might be causing the damage, and basically slowly restart the others. And with a bit of trial and error, I've now managed to continue the supplements, and I didn't have any more health problems. So
amazing.
It was very much constant back and forth, and
it's that fine tuning. It's always going to be that fine tuning for because, and this is why I always talk about the fact that when it comes to fertility and general health, I do not believe in just telling people, oh, take these supplements. These are the supplements that are good for you. That's why I've never written a book and will never write a book that tells you that these are the supplements you should take if you're trying to do whatever. And the reason is that, in my opinion, it's a disservice to many people out there, especially the types of patients that we treat, because we really specialize in difficult, complex cases and situations where people typically have tried everything, and it's not as cut and dry. It's not as easy as going, oh yeah, take these things. These things are going to be good for you. Because it's not. Sometimes there's a lot of fine tuning and trial and error and testing to see how does the body respond. And the way that one person responds is different to how another person responds. We talk about, for example, male factor infertility. You might be dealing with, let's just pick one parameter and say that sperm count is low. You might get and line up 10 men with low sperm count, and you might have 10 different ways of addressing the reason and how we're going to optimize that sperm count, because each person is an individual. So it's not just as simple as going, okay, take the stuff, go. There was some kind of, and this is the reason, why our program has a 78.15% live birth rate versus, you're kind of up to 30% of IVF, because we really are looking at people as individuals.
Yeah. So we were working towards a tandem cycle with egg and sperm donor, but still basically a 4-way cycle. It was going to be quite complex. And I was getting really quite discouraged just with the whole thing. I thought Ross is barely managing to keep up with the program. And, I've had to massively scale back. And I just thought, how can it be working? Then Alison asked us to get a repeat sperm analysis for my partner, and we, he went to the clinic appointment without me, but they sort of like voice dialed me in, and he was like, "Oh, my sperm's gone up, it's gone up," and this was like repeatedly having a sperm count of less than 1 million.
Yeah.
Less than 10 sometimes.
And less than 1 million, let's just put it into perspective for people who might be watching this. Less than 1 million, the World Health Organization recommends that in order to be able to affect a pregnancy, we need a minimum of 20 million in terms of count. So less than 1 million is almost getting to the azoospermia level of, where we have
10.
Yeah.
It was really severe. So it had gone up to, something like 6.7 million. And we were like, yes, such an improvement. And our NHS consultant was like, what have you been doing? Like, he was really impressed. And it's like, whatever you're doing, keep doing it. Let's think about not using a sperm donor anymore and just do the donor egg tandem cycle and using your partner's sperm. So I was really encouraged by that. And then
something must be working.
Exactly. I was like, yeah. And, you can't test egg quality, but I was like, if he's had an improvement, I must be having an improvement as well. So I was, really, I felt really positive about that. And then he got a date for a transplant through an exchange scheme. So his sister matched with somebody else. So there's like a 4-way kidney exchange. So we had a date. So we decided that we needed to freeze some more sperm whilst it was much better, just in case any of the surgery or the drugs had an effect. So we went back to Oxford to do that test, and the report just said normal. And I thought they meant that the protein was normal that they were looking for. But in retrospect, they probably meant that the whole thing was normal.
Yeah.
And then we went off for a day trip to Belgium because he was on dialysis now. So we literally flew into Belgium, saw the doctor, froze some sperm and flew back. And then I got an email saying, you might also want to consider not using a sperm donor anymore, that doctor was saying. I was like, yeah, that's good. That's what,
nice.
That's what we're going to do. And then she said, his sperm has improved. It's improved. That's all she said. I was like, improved to what?
What exactly?
Just casually wrote back 52 million. I was like, what? And Ross was like, no, she's got the decimal place wrong. She means 5.2. I was like,
cute.
I'll check. And she was like, no, 52 million. And I even said, are you sure it was his sample? Definitely a sample, 52 million. And this was a month before the transplant date. So, we decided to properly try that month. Even before speaking to Alison about it, we just decided to go for it. And then he had his surgery. I had some cramping and some spotting, which I don't normally get. My period just normally starts. So whilst he was in hospital, I did the test by myself and did very little faint positive, and I went out to buy some more digital tests. And
surely, is this right? It's the whole thing about women trying to do their pregnancy tests. It's like one is never enough.
No,
right?
No.
One test.
I can
one
say
test is never going to do.
And it wasn't good for my mental health, but I turned into a testing person. Not every day, but
just to be sure.
And I went and I told him in hospital, not in hospital, we managed to walk outside, so it wasn't in front of other people, but he had his catheter bag, his drip stand. I was like, come on, let's get outside. I was so excited to tell him. And it was a really surreal, very muted moment, actually, because I think I was still in shock. And then he was in shock, and then we just sat on a bench outside the hospital going, oh, basically. So we went from not being able to even go down the adoption route to doing the double donation route to having a biologically, naturally conceived child. And And throughout the pregnancy, we had the support from Alison. Again, I had some more problems, but, that part of the journey I was expecting, but the whole, 2.5 years trying to conceive, it was just, I just cried and cried and cried and cried and cried and cried and cried. There was 2 really bad crying moments. One of them was after our second boiled my baby point, which I was really upset about. So my period started quite early in the morning, about 6 o'clock, and we'd given up chocolate as part of the challenge, trying to do our best.
Trying to be healthy.
A massive Ferrero Rocher box, and I basically at 6 o'clock in the morning just ate them all really fast, just one after the other. Basically, just crying, just really crying, shoving the chocolate. Oh no, never gonna be again. Because I'm
sorry, these are the types of things. I know that people watching, they're just going to be going, I understand that moment. I get it. And I totally get it. But, it's amazing, the benefit of hindsight, isn't it? You look back now, and this is the most beautiful thing that I think we need to hold on to, the memory and the understanding of, and the faith and the belief of, is that one day you will look back on your journey and you will be able to laugh about some of the things that you have been through, because in the moment, it just feels like it is unending, and that things are never going to get better, and you're never going to have the being able to hold that beautiful baby that you've envisioned for all of your life, in your arms. But, one thing that I know for sure, having done this work for 20 years, is that many times when people get in there, they do what needs to be done, they do the work, it's incredible, the transformation that ensues and the difference that it makes, and the difference that one's own choice can make in the whole process. You're a living, breathing proof, not only from Rosa's perspective of, having very little sperm, to kidney failure, to kidney transplant, to, all of the story and the pieces that you guys have been through.
We got pregnant when he was at his sickest.
But you see, it's because it's all of the work that you had done up until that point. So even though, and of course, the treatment that we were giving you was supporting him, at least having the foundational building blocks to be able to optimize sperm.
And he did so well with his transplant. His recovery was just so spot on and smooth and textbook, that again, had we not been really homing in on diet, he wasn't doing exercise, but he was trying to stay active. Had we not focused on that, he was definitely the healthiest person on the ward. I can tell you.
Yeah, I absolutely believe it. Yeah, for sure. And oh my gosh, it's sometimes it's the looking back, isn't it? It's the looking back and saying, wow, how far we've come. So what happened? So then after, so that was that the first or the second biggest crying moment?
That was the first really bad crying moment. The second really bad crying moment was probably worse, actually, was the appointment where he said, the next appointment where he said, it must be your eggs as well. Your eggs must be rubbish. There's very little chance of you ever having a biological child of your own. And I could not. I was driving, I was crying. I got home, I was crying, just crying. I had an appointment with the hypnotist that I'd been seeing. I've not mentioned my fertility problems to her, but when I arrived at the appointment, she was like, I kind of knew from some of the subcontext of some of the stuff that you've been saying. And I was just I've literally sat in a chair, trying to explain, sobbing. And then we started the session. I was still sobbing, but somehow during the session, she's so good. She just calmed me right down, and I managed to stop crying after about 4 hours. I finally managed to stop crying, and so I think I left with a bit of conviction, right? something needs to be done. I thought that was my rock bottom, but actually the adoption thing was my rock bottom. And I actually didn't cry at that point. There was no more tears to cry, really. I was just like, right, I don't even know where to go from there. So I'm quite a spiritual person, but I'm also a very scientific person. And I say to many, many people, anyone who will listen, that the miracle wasn't you and the program. That's science. Everything you said, I looked up. There's paper after paper after paper after paper. It is science. The miracle was finding you out of, there's just so many people on the internet saying, I can help you, take this, they're just telling you to take a whole list of drugs and supplements that you don't know how, like you said, you just don't know. It's not personalised. And I was very much deep into the forums as well. And everyone was like, do this, do that, do this, do that. And to find you out of, how many people is there on this planet is just...
Oh, God.
That is...
You made me cry.
All the time.
Oh, Essie. Essie, it's, you, honestly, like, I'm seldom speechless, I have to say. And I don't normally cry in my Facebook lives. But when you spend your whole life doing something and, you live and breathe and all you want, all I always wanted was to be able to make a difference to people's lives. And, it's incredibly rewarding. And I think that, to me, what's gratifying in what you just said isn't even so much about me or, the fact that we do what it is that we do. I think it's just the fact that it's a tear of gratitude for the fact that being who I am and following my true path and my beliefs and my values is able to help you and, is able to make a difference to your life, but not just your life. Every other life that yours touches, and now your beautiful son, and it's that legacy. And gosh, you touched me so deeply, and I can't thank you enough for.
Can I just quickly say one more thing about the program I forgot to mention?
Sure.
The book club.
Changed my life. Book club. I tell you.
It's just, you very much work on you as a person, and it's not about your fertility particularly, but you get to spend time with like-minded people who don't think you're crazy for having everything out of glass and completely ditching gluten. And, you get to work on things that you never even thought about. Like, I've started stocks and shares investing after we read a book, and, that played quite a large part in the book. And, the miracle morning and all sorts of things. It's just, it's a very much like
it's beautiful, and I love that you say that. And people are probably going to be going like, book club, what? Huh? But how is this going to help my fertility? Well, I think that it requires a little bit of context. And one of the things that I have always known, in my life, and I have always been, as we've spent a lot of time together over the years, is that I am an absolute fanatic to constant and ever-ending improvement, to not only improving and optimizing every aspect of what I am and how I can do things. I believe that as humans, we all want progress in our lives. We all want to know that we're growing. We all want to know that we're contributing. At the end of the day, when our basic needs are met, we need to be able to stand on our 2 feet and go, okay, well, what do I stand for? What do I represent? And what do I want my life to mean? And I think that we often lose track of that on our fertility journey. We start to see ourselves as separate from others, are separate from the things that essentially, and not only that, we start to feel like we're lacking something. You know, we start to feel like we don't have the thing that we most desire, that we most want, and that everybody else is getting so easily, right? And so there was this real sense of loss and grief, and, you know, and so one of the things that I knew very early on when I created this program and I created this methodology is that ultimately I wanted my patients to no matter what, whether they got a baby or not, whether they, you know, ended up with the outcome that they envisioned or not, that they had the sense within themselves that they were whole and they were complete, and that they could go out into their lives and focus their attention, their energy, and the things that they brought as their gifts into this world, into whatever it is that they did. And so one of the reasons and one of the factors of that is that I wanted to create that into our program, or introduce that into our program. And that's why we have, you know, book club, emotional release sessions, breath work, hypnotherapy, you know, all sorts of different types of things. Not everybody utilizes all of them, and not everybody necessarily gels with all of it, but it's all there. And so it's kind of like, it's what you choose to engage in and how that then helps to transform you and who you are. Because I also know one thing. The fact is, the vast majority of our patients, close to 80% of them, will take home their baby. So from my perspective, and the reason that I do what I do is not to put another baby into the world. I do what I do because I want to ensure that we are creating families and that we are making this world a better place, one healthier baby at a time, right? And so if we can create the foundations for prospective parents to be their very best so that they can pass that on to their child, I feel like, okay, you know what? We're doing something good in this world. And so that's why I focus so much on personal development, on making sure that on the emotional component, so that we can bring people to that place of equanimity, you know, which is calm in the face of chaos, because infertility can and sometimes is massive chaos. It's a questioning of everything. Absolutely. Destabilizing is a really great word, right? Because all of a sudden, all the things that you imagined that you would do and how your life was going to be, they haven't somehow figured or turned out the way that you had planned or that you had imagined, right? So it takes a bit of inner work to be able to come to grips with all of that. And so, and I'm so glad, you know, like that was it. So many people say that to me, and I seem like, oh my God, the book club was the best part of the whole program. You know, it's beautiful. I love it. I love it. And especially the men, you know, it's amazing. One of our patients that I spoke to last week, same thing. He's like, oh my God, book club was the best thing for me. You know, it's like, oh, how good. And the thing about book club too is that we do books about all sorts of things, right? And that's the really cool thing, isn't it? That we're not just talking about fertility all the time, that we expand our horizons within that context. So that's awesome. So tell me, so then you had a baby?
Yes, we had and I was still getting help. I was still getting help from you guys. So we had.
That's what I love.
Yeah.
You know, the fact that we stay in each other's lives. I often say to patients, you know, we stay in each other's lives, especially if you have a baby from us, which, as you know, Team Rosa babies, we stay in each other's lives forever, you know, which is such a beautiful thing.
So I had a problem with milk. I didn't have very much and my baby couldn't latch. So I ended up pumping for him for as long as I could mentally. And I'd never had herbs on the program. I was lucky enough to be one of the people that was never prescribed. But when I went to Alison,
but there's a reason for that, and you know, we couldn't necessarily, like, there's other things that were at play, but normally that doesn't happen, people. Just so you know.
Herbs came, and I was like, just do it.
See, he didn't get away with it completely.
No. So, you know, the support is literally there, like all the way through. You know, and now we are starting to think about baby number 2. So, you know, we will we'll be getting support again.
Yeah, we can't wait to support you. That's one of the things that I love the most, is the fact that our patients, not only they come to us for their first babies, they come back to revisit. And, we're now up to 3rd revisits for 4th child, where people came to us originally with no child, so it's beautiful, and it's so heartwarming.
And I've managed to change quite a lot of medical professionals' views,
ideas.
And a lot of my medical friends after I became pregnant were like, we thought you'd just been taken for a ride, really. And I was like, no, not at all. And they were like, you were at a vulnerable place and you just found this woman on the internet, but now you're pregnant. I just couldn't.
It must have been for real.
They're very much in belief of, the small print.
Yeah.
The small print. And not every paper is going to have 1,000 people in it. But the 40 that are reproduced time after time after time is worth looking at. And I think sometimes as medics, we do actually get stuck in we need big multi-center trials for this and this and that. But fertility is such a specific, was individualized problems that you're never going to have trials like that. Ever.
No, and you're never going to have trials like that, because RCTs, as we know, reproductive epidemiology is really very, very undone. Vulnerable populations and so on. So it's just really not something that is conducive. And also, it's difficult, to study per protocol situations like this. We have done it, but again, we have done it based on the fact that this is the work that we do. So, it's interesting, but we've got, through my affiliations through Harvard and everything else, we've got a whole lot of extra things coming up in the next 2 years that are going to be ultra exciting.
Really looking forward to that and being able to show some of them that doubted.
And you will.
Where's the evidence?
Yeah.
And I was like, well, I can find you these smaller papers, but
it's interesting, because the evidence, there is so much evidence and there's so much epidemiological evidence. But the fact is, it's what you're talking about in terms of research. We want to see RCTs. Well, you're not. You're not going to see RCTs in this area. And and you can go to the biggest study centres, Harvard and Harvard-affiliated hospitals. Obviously, through my studies there and my connections there, I'm doing a whole lot more work with them. In fact, I got an incredible request yesterday to be a part of a big, long-term longitudinal study that's going to be done specifically in this particular, area. And it's just like, and I was talking to one of my colleagues and I said, well, we've done this, you've got to be a part of my team. I'm like, okay. So we're definitely working on doing a whole lot more in this area. And there are a couple of other research teams also at Boston University, and so watch this space, Essie. There will be some lovely papers for you to be able to share with your medical colleagues in the coming years, for sure.
Yeah.
My darling, thank you. I couldn't be more grateful, and honestly, you touch my heart. It's so beautiful to be able to be of service and to be able to tell your story, on the other side of it, and even have a laugh about your Ferrero Rocher moment a couple of years down the track.
Thank you so much for all your help and all the changes, long-term, lifelong changes that you've made to our lives, and for our beautiful, beautiful, beautiful son who is peacefully sleeping away, oblivious to the challenges that he causes mummy and daddy.
Well, he'll watch this. We will create a beautiful keepsake video for him to be able to enjoy for his future. And look, Essie, thank you so much. I'm so grateful, and send my love to the boys.
Thank you very much. Thank you.
All right, my darling. Big love. Bye for now.